We have to prep for a 25-year-old client. She had a motor vehicle accident and she has a possible leg fracture.
The client is not a part of the pre-interaction phase. During this phase, it is the RN's responsibility to gather available data about the patient, including medical history, and communicate with other healthcare providers who have information about the client. It is also the RN's responsibility to create a warm, comfortable environment for the patient to begin the healing process.
So Michelle, what happened? You just punched out of your arms again.
I was going home and a car came out of nowhere and hit me in the side. I'm in a lot of pain. You think I can get something in my life?
During the orientation phase, the RN should introduce herself and set the tone for the relationship by creating a warm, empathetic environment and create priorities among the client's health problems in order to create goals. However, the RN shows negative nonverbal examples such as putting her hands on her hips and not making much eye contact. She treats the patient as an inconvenience and does not include the patient's needs for pain medication as a priority.
So you know the procedure for a situation like this. You work here. I will do the assessment and give you some info later.
That hurt. Are you sure I can't get anything for pain?
Yeah, Michelle, just give me a minute. I need to send you the x-ray. I think you may have a broken tip.
The RN has demonstrated lack of empathy for the client by not providing emotional support, which leaves the client dissatisfied.
Michelle, how are you doing? I got here.
Sir, I need you to wait in the hallway. We're about to send Michelle up to x-ray. Now is a good time to get off the top.
Hey Kim, do you mind calling for a transfer? Michelle needs to go to x-ray.
Sure, no problem.
Hey Jeff, it's Kim from ER. Listen, I need you to do a transfer from ER to x-ray. Michelle from second shift, you know, she was in a car accident and she has a possible broken leg. I know this could just so ruin your night. Okay, thanks Jeff.
Some other barriers include lack of caring by interrupting the client and ignoring her husband. Also, members of the healthcare team have shown a lack of confidentiality as they have gossip about the coworker who is now a client.
Hi Michelle. So you broke your tibia in 3 places. You're scheduled for surgery to reset the bones in an hour and a half. I'm going to send you up to prep, okay? Good luck with that.
Hi Michelle, my name is Dana and I'm going to be your nurse tonight. How are you feeling?
I'm fine.
Is anything on your mind that you want to talk about?
Yeah, I'm really upset the way I was treated earlier in the ER. Looks like nobody cared.
RN demonstrates knowing her client by making an effort to understand what upset the client and finds cues of client's anger. The RN also demonstrates being with the client by being emotionally and physically available for her in her time of need.
I'm sorry Michelle, they probably forgot about being professional since you're a coworker here. Okay. No, that's not an excuse for their lack of caring for your feelings. But they probably feel that they don't have to impress you because you are a coworker here.
Really upset. It was hard to relax, but I guess you're right. But next time I see them, I'm going to give them a piece of my mind. But since you're here, do you think you can give me something for my leg for pain?
Not a problem. I'll go get something for your pain and a glass of water, okay? I'll be right back.
The RN uses important aspects of verbal communication, including a soothing tone of voice and simple and effective words to avoid confusion.
Okay, here is your pain medicine. Here's some water. So today we're going to practice on walking with crutches. So we can, hopefully we'll get you good at it. So our goal is 50 feet today. We're going to try.
I don't know if we're really up to getting up and doing the crutches today.
I know it probably sounds really hard right now, and you think you can't do it, but I think it might make you feel better to get out of bed. I'll be there to help you the whole time, I promise, so don't worry.
Well, I guess you're probably right. I've been laying here for a long time. My back's starting to hurt, so I guess I can give it a try.
Okay, I'll go get the crutches and I'll be right back. Okay, Michelle, I'm going to try and move you to the edge of the bed, okay? So I'm going to help you. Good. Good job. All right. So now this is the gait belt. I'm going to put it on you, and this is going to help me in case you fall so I can grab you. Okay?
During the working phase, the RN and client work together to set goals and provide necessary action to accomplish the goals, and provides information to the client needed to understand and change the behavior.
Okay, good. Okay, I'm going to lower the bed. On the count of 3, we're going to try and stand up, okay? 1, 2, 3. Good job. Okay, now I'm going to give you the crutches. Very good. Now we're going to try and walk 50 feet. If you have any pain, just let me know and we'll stop, okay? And I'm going to hang on to you.
Remember how she said after you irrigate, check the
Good job.
The RN demonstrates the doing for aspect by lifting the client's legs and helping the client to a standing position with her crutches, which are both aspects that she could normally do for herself. Through enabling, the RN continuously informs and explains the processes needed to achieve the goals and helps client through the completion of unfamiliar events. And the RN maintains belief by consistently keeping faith in the patient and reassuring her she will recover to her previous state.
It wasn't as hard as I thought it was going to be. Thank you for your help.
Not a problem. That's what I'm here for. I'm going to go tell the doctor how well you're doing, and maybe we can get you out of here sooner. Okay, I'm going to go grab him.
Hi Michelle, how are you feeling today?
Kind of in a little bit of pain, but I'm sure that's to be expected.
Yes, you're still going to have some pain, but that should subside in a few days. Dana has been telling me about how good you've been doing, so we're going to try to get you out of here as soon as possible. So you can recover at home in a better environment. I want you to call my office if you have any problems.
I'm so quick. I don't think I'm going to be able to do it all by myself.
Don't worry, Michelle. You will do great at home. You are getting around so well with the crutches, and you have a home nurse that's going to be stopping by for a few hours every day for the first week to help you adjust to recovering. Everything is going to seem hard at first, but as time goes on, it'll get easier and easier. I would take your pain medication as ordered so you don't feel so much discomfort when you're trying to get around. And we can also send you home with a walker too, since walking with crutches can get tiring and uncomfortable. The doctor is going to write you a script for physical therapy in an outpatient facility. It'll probably be a few times a week for a couple of months. You should have really good results considering how active you've been before the accident.
Right, I know when I get home I'll do just fine. It's just going to be hard at first.
Sure is very scary, but you are going to do great. Just keep a positive outlook and everything will fall into place. Go ahead and help you up. Okay, good job. Bye, Dana. Bye, Michelle. You'll do fine. Good luck. Bye, Frank.
During the determination phase, the RN evaluates on the achievement of goals with the client and reminds the client that the end of the relationship is near.